Muir Health is a 3-hospital system located in the Bay Area, about 25 miles east of San Francisco. We have a specialty hospital, a trauma center with orthopedics, children's, and neurology. We have a second hospital close by that specializes in heart surgeries. We also have a behavioral health hospital. The unique thing about John Muir is that we're independent. And because we're independent, how we maintain our independence is collaborating with other partners. So UCSF is one of our partners. Same with Stanford Children's Hospital in Palo Alto. And those are two of our larger partners that we exchange patients back and forth with. I came on board to John Muir about 4 years ago and learned that we had Sectra PACS as our PACS system, and I didn't know who they were. I said, Sectra who? But quickly learned that they were going to be a company that I could truly have a relationship, a partnership with, as to solve problems. They weren't just selling me solutions, we were going to problem solve things together. And one of the recent issues that we have had is trying to move images, just even here in the Bay Area, between hospitals. There's about 25 hospitals here in the Bay Area. We have spent a lot of money on buying CD burners. We've spent a lot of money on mailing those CDs, and we've spent a lot of money on couriers, moving, driving around. I mean, some hospitals, a major hospital will spend up to $250,000 a year just on a courier to move these CDs around. So Sectra and I got together about 2 years ago, and we talked about this, and I found out that they had a similar product of what I was looking for, although located in Europe. And I said, well, what can we do for the US? And so the next involvement was just trying to outline what we needed to do with the IEP and make it work for us. And so we have their PACS product. We're soon putting in their cardiology product. We have the IEP, which has become very successful. We've also purchased their dose tracking product, which is measuring the dose of patients. And we also have embarked on the imaging archive. We have signed with Sectra to do our long-term archive, which is great because for me, this is a platform for the VNA. With Sectra, we've been able to incorporate the web product, been able to incorporate the IEP, the dose track, with just a single interface. Really, the only thing we have interfaced with Sectra is our EHR system and our voice recognition dictation system. And so being able to utilize all of those things within our PACS with 2 interfaces has just been huge. It has saved on costs. When you communicate hospital to hospital, it's absolutely in the best interest of the patient. And making sure that the Sectra IEP had a very secure cloud, very secure interface was very important to us. I think one of the things that people don't realize about Sectra is it stands for Secure Transmission. This is where the company got its start. So from a security standpoint, they've got it going, which is probably why they're the ones that reached out to us when everything goes south around the world. I was actually in Europe when the WannaCry virus hit and was looking at my email, and I have friends that live in England and work for the National Health System, and I'm like, hey, I'm in your time zone, I feel your pain, I'm sorry. Do you know, out of all of our vendors, the only one that sent us an update of how they were dealing with it and checked on us was Sectra. Nobody else checked on us on any of our IT systems, none of our vendors. So not only was I impressed, but our IT senior staff was impressed that, wow, here's a vendor that, actually proactively called us and said, okay, all of your systems except for this is patched and this is what we need to do. Very impressed. With Sectra, they were able to work with the other companies out there, and there's lots of image exchange vendors, but they were able to work with other customers out there to do the exchange in the cloud. And that's what you need to do, is you need to bring people together and do these vendor-to-vendor conversations. So when considering a PACS system, when you have a multi-hospital system, you first and foremost have to decide how you want that data presented. You want one patient record. You don't want to have Linda Smith going into one hospital and then they go into another hospital as Linda A. Smith and then have different medical record numbers. So you've got to be able to have a PACS system that can integrate those records no matter what hospital they go to. And I used to work for a hospital system that had 32 hospitals. And so it was important that there was some sort of an enterprise master patient record that tied all of the different things, because I think, and John Muir does this too, is that you have different hospitals for different reasons. I may go to one campus because I have a cardiac problem, but I may go to another one for neurology. And I think that being able to go back and forth and your images being part of that database is huge. One of the things on reason why John Muir really likes working with Sectra, it's that close relationship to solve problems and to put aside the barriers that you sometimes have with companies that say, we can't show you the code, or we can't, it's going to take a year before we do this. I just have not found that with Sectra. There's a real passion there for Sectra to solve your issue, especially around patient care. And I think that's what makes Sectra very different from all the other vendors that I've worked with over the years. And I've been in healthcare 30 years.